before the upcoming university exam. So first of all, some dons which you have to do regardless of any subjects. Don't get into any FOMOs. Okay, don't get into any what unnecessary thoughts, some things which are not under our control, like okay, whether the questions that I am studying will be coming for the exam. Of course it will be coming. Okay, don't worry, what all you are reading only will come in the exams. Okay, so don't bother much about that. Okay, everything will be from your textbooks and the questions that you are reading. Suppose if any questions which come out of what you are reading, you should be prepared yourself to answer those questions. At least you should make sure that you are attempting those questions. Don't leave even a single question unattempted. Second thing, don't be over bothered that okay, my friends are saying that from those college IA papers they will be asking this time, from this college IA papers they will be asking this time. Don't. Okay, we can't predict those things. So don't what distract yourself from the preparation and go beyond all those unnecessary things. Okay, what all you have read so far, take this upcoming days to revise once again. Okay, this is the second thing. And of course, stay hydrated. Take care of your health. Make sure that you are not getting any cold or anything else in the upcoming days, because you know it is a winter season, so we may get cough, cold, fever. So make sure that take care of your health. Okay, so that is very, very important. And the next thing is subject wise. So in pathology, don't compromise on any essays. Don't compromise on any essays. Okay. The second thing is make sure you are reading from what the peripheral smears. Okay, peripheral smears, those diagrams you won't read usually. Make sure you are going those through those things. Make sure you are preparing. Okay, because this is the time for revision. Make sure that all questions you are preparing under the following headings: etiology, pathogenesis, better in the form of flowchart, and salient points in gross and salient point in histopathology. Clinical features should be mainly like to help you to find the proper diagnosis. For that, make sure you go through all the case scenarios which I have uploaded in the group. The third thing in pathology is think a while and answer. When you see some words, don't immediately, when the BP is low, don't think that it is shock always. Okay, so think a while to a conclusion. Then, so this is the pathology. Okay, so what are the things you should not do in pathology? Don't waste your time reading line by line in every questions in pathology. Make sure you are reading just the clinchers. It will help you to save time, and at the same time you can read numerous topic within a short period of time. Coming to pharmacology, make sure you are reading the uses of all drugs and the salient side effects. Don't sit and mug up all the side effects. Okay, like nausea, vomiting. Okay, don't. Every drug has some certain clinchers, okay, which produce some characteristic side effects. Important. Mechanism of action, important. Few clinical uses. Okay, there are a lot of drugs used for multiple diseases, but that drug, for example, metronidazole, okay, anaerobic infection, what parasite, what protozoa. Okay, be specific while reading so that these specific points you can highlight in the exam. So that is about pharmacology, and do see the formulas, okay, in general pharmacology. Do see the formulas in general pharmacology. Okay, sometimes any questions or any MCQs on bioavailability, loading dose, maintenance dose, first order, second order kinetics, all those can be asked. Then coming to microbiology, so and okay, what are the dons in pharmacology? Don't waste time reading each and every, okay, only the clinchers. Then don't mug up all the classification of drugs. Essay question mainly focus on the classification. Short notes, please don't go beyond mugging up all the classifications. The third thing, coming to microbiology, what are the dons? Please don't forget to read lab diagnosis in detail. It is the lab diagnosis which plays the major role in microbiology. In lab diagnosis, make sure you are studying what are the selective medium, transport medium, what are the culture findings. In case of virology, the immunological findings, okay, in serology, IgM, IgG assays, okay, then the molecular analysis, and what are the what findings in that. So make sure lab diagnosis, that too in some 10 points, each bacteria or each organism, make sure you have some 10 clingers in lab diagnosis. And about the morphology, don't focus, but don't waste your time mugging up all with, okay, it is urease positive, catalase negative, oxidase positive, methyl red negative. Don't waste your time mugging up unnecessary these stuff, because it is very tend to get forgettable. You will forget them very easily during the exam. Clinical features, again, clinchers, okay, Bacillus cereus, food poisoning, Staphylococcus aureus, toxic shock syndrome, then Streptococcus pyogenes, necrotizing fasciitis. So each organism produces some characteristic disease. Just go through those points, lab diagnosis, and don't waste your time much more about the biochemical test and all those. Do give importance, okay? Don't make this mistake. Don't neglect the chapters like general microbiology, immunity, infectious diseases and control, okay? Applied microbiology. You will get many questions from these chapters. Don't ignore these chapters. Fine.